I think you've noticed by now, life is kind of continuing on during this pandemic, and babies are still being born. We have Celeste Thomas. You're a certified nurse midwife with Intermountain Healthcare, and I'm so happy to talk to you because I actually delivered my baby with a midwife in a hospital, and I felt like so safe, so safe. Yet I also read that it is actually safer in a lot of ways to have a midwife help deliver your baby. Celeste, welcome. And have you heard the same thing?
Yeah, absolutely. So in the past couple of years, there have been a number of large studies that looked at optimal maternity systems and outcomes. And what they found is that women being cared for by midwives as the lead on their maternity team has been found to actually be as good care or safer than any other model. So yeah,
it's amazing to hear, and it is so neat that you have that relationship with your midwife as well. Now, tell me a little bit of background about you. How many babies have you delivered? Why did you become a midwife, and why do you suggest other women, utilize your services?
Yeah, so I first became, many years ago, I was actually a women's studies minor and an English major, and my good friend invited me to the birth of her first child, and I just fell in love with that process.
Oh, and now 1,000 deliveries later, you said?
Almost 1,000 deliveries later, and having had my own 3 children, and now I'm an old mom. Yeah, and so I really just fell in love with the midwifery model of care. And the midwifery model of care is really a partnership with the woman. So we see our role as caring for women, but also giving them information and then supporting them in the decisions that they feel are best for themselves and their family.
That's what I felt. It felt very empowering, and knowing that you would let me do my thing and jump in if needed, and with the care that is needed. Now, Intermountain Healthcare has a midwifery staff. I think that is amazing.
Yeah, and actually, a lot of people, when they think of midwives, think of birth out of the hospital, like in home or birth centers. And there are those midwives. But actually, the majority of midwives, about 90% of midwives are doing deliveries in hospitals across the nation. So that's where the majority of midwives are doing births, because that's where the majority of women in this country are giving birth.
And it is still safe to deliver a baby in the hospital. And we have a lot of information from Intermountain Healthcare about the precautions that they're taking. And yes, definitely come and still have your baby in the hospital. You've told us it's safe. You guys have things in place. We'll mention that on our website. Where can we send people to get in touch with you, Celeste?
Yeah, so you can go to intermountain.org and put in nurse midwives, and you'll see all of the different hospitals that have large nurse midwifery practices that serve women in different communities all over Utah.
I love that. Intermountainhealthcare.org. We'll link you over on our website. Celeste, thank you for doing the good work, and thanks for on memory lane for both of us moms.
Sounds good. Thank you so much, Amanda.